Paediatrician and medical research scientist Dr. Glenda Gray was chosen as one of Time magazine's top 100 most influential people in the world, and this for her work in the prevention of HIV between mothers and babies. Dr. Gray is the CEO and president of the South African Medical Research Council, and she joins us now via our Cape Town studios. Very good evening to you, Dr. Gray. Thanks very much for joining us. Congratulations on making this list. I suppose it's a testament to a lifetime of work that you've been engaged in.
Well, I think it's a testament to my love for science. I really love science, and I think it has shown in being acknowledged as a scientist.
All right, well, let's talk about the work that you've been doing. What drew you towards HIV in particular, particularly at a time when a few scientists in the country were doing it, and yet it was quite a scourge already?
So I qualified as a paediatrician, and as I qualified, the HIV epidemic exploded in Soweto, in Baragwanath Hospital. And so every third kid in my ward was HIV infected, and we were just looking at these babies dying. And I then turned to science. I was a clinician. I didn't think I was clever enough to be a scientist. And I looked at ways of trying to interrupt mother-to-child transmission. And in those days, there was no AZT or antiretroviral therapy. And so we were trying to minimize breast milk transmission. And then I got involved in antiretroviral research. And eventually the work that we did, both in Soweto and in the rest of the country, got translated into programs. You know, there was a lot of issues between that time of rolling out and the time of discovery. You know, we had AIDS denialism, we had a government that didn't want to roll out mother-to-child transmission, and so we got involved as scientists, as activists, and that's when I learned the power of science, because if you have evidence, you can use power to change things, and we definitely used our knowledge around mother-to-child transmission and HIV to try and influence policy so that children wouldn't get HIV infected from their mothers. And so that's why I like science so much.
All right, so to the layperson like me that don't quite understand science all that well, tell us a little bit about the science that is helping protect babies and not get HIV from their HIV-positive mothers. And have we at a place where we can say that we can safely say that most kids don't need to be born with HIV?
Exactly. So with antiretroviral therapy, this will interrupt transmission. So mothers take therapy while they're pregnant. When the baby's born, we make sure that the baby goes on treatment for post-exposure prophylaxis. And while a mother continues to breastfeed her child, we want the mother to stay on antiretroviral therapy. And by doing this, we can virtually eliminate pediatric HIV. There is a small amount of HIV that still is transmitted through breastfeeding, but we're working on this, trying to look at an HIV vaccine or other kinds of things like neutralizing antibodies to interrupt breast milk transmission, or to look at long-acting antiretrovirals to stop that last bit of transmission. So we say it's the last mile, and the last mile will be to completely eradicate breast milk transmission. And we're almost there.
So how were you able to make these breakthroughs all the way here in South Africa? I mean, the whole world is looking at this. They have fancier equipment, I would guess, and somehow you were making these powerful breakthroughs.
Well, I think we were in a situation where there was a lot of HIV and we wanted to do something. And so we asked curious questions and we worked together with international partners. We were just coming out of apartheid, and there was an academic boycott, and at that time people didn't know where to work or who to work with, and we stood up and said, you know, come work with us. You know, we want to try and work and solve this problem of mother-to-child transmission. And so we worked with people from KwaZulu-Natal, from University of Cape Town. I worked at Baragwanath Hospital, and we worked with UNAIDS and WHO and other people to try and find ways of finding affordable. At that stage, AZT was very expensive. So we tried to look at short course treatment, affordable ways, and that's where the whole nevirapine story came in, where we worked to try and find the shortest and the most potent intervention to interrupt mother-to-child transmission.
So preventing babies being born with HIV is only part of the story, because they become adults and young people and they can still contract the disease. And this is now the next layer of research is making sure that we find a cure or a vaccine to prevent future infections. And this is the area that you're in now, HVTN 702. Tell us about that and what does it mean?
Yeah, so we have to try and interrupt transmission to young women. So if we can interrupt transmission to them, we can prevent mother-to-child transmission. And so around the early 2000s, I became involved in trying to find an HIV vaccine. We were working with scientists in South Africa. There was a program called the South African AIDS Vaccine Initiative, called SAVI, and together with scientists from all over South Africa, we started to embark on a whole vaccine development program. And at the same time, we also started to engage with international partners. At that stage, hardly anybody was working in the clade C epidemic, which is where we are based. So we have an epidemic of HIV that's clade C. In the US, it's a clade B epidemic, and at that stage, nobody was interested in a clade C vaccine. And so we had to lobby to make sure that industry and funders started to look at vaccines that would be appropriate for one of the hardest hit countries in the world, which is South Africa. And so we worked both locally and internationally to try and find vaccine programs. And this has culminated in HVTN 702, which is a clade C HIV vaccine regimen. We've adapted it from a vaccine regimen that was found to be moderately efficacious in Thailand. So we made it clade C specific, and we changed some of the components of the vaccine to make it hopefully more potent and durable. And we did some early studies to make sure that this vaccine regimen was immunogenic and safe. And now we're embarking on the big trial where we're going to try and see whether this vaccine is efficacious. And so this is the first HIV vaccine trial in 7 years, efficacy trial. And it's the first time in a single country will try and find a vaccine that's efficacious and hopefully take it through a process that might lead to licensure.
So we're very, very close, Dr. Gray, to finding a vaccine for HIV.
Well, I think whether we're close or not, the trials that we're going to do in the next couple of years will definitely define the issues around what protects people against HIV. And the vaccine trials that we're doing now will either be efficacious or they will really help us leapfrog us into the next area of development. And so what I've learned about science is it's hard, and sometimes we make mistakes and sometimes we get lucky. And this trial will help us. Either we'll get lucky, or otherwise it will help us to make better and stronger and more potent regimens that will eventually be efficacious. So it's a long road to be successful with an HIV vaccine. It's eluded scientists since the 80s when we first discovered it. And you know, sometimes we have to make small little steps towards progress, and sometimes we just leapfrog. And hopefully these trials will help us leapfrog to where we need to be.
So now I believe you're one of 6 children. As a young kid you already wanted to be a doctor, but I don't think you knew then that you would be a globally recognized doctor and scientist in the future. And I'm sure that there are many people abroad trying to bring you over there to work with them. What's kept you here at home?
Well, I love South Africa, and I understand the disease burden of our country, and we need local solutions for local problems, and we need people that are passionate and care about the citizens of the country. And I'm a doctor, and so I love what I do, and I love trying to help South Africa, because if we can help South Africa, we can help the world. And so, local is global, and so it's better to be in a place where you know.
And I suppose that you're also now, with what the frontiers that you're exploring and breaking through, are bringing knowledge to the world and teaching other parts of the world how to move forward.
Yeah, so I think we've shown that South Africa is a formidable country with great scientists. I'm part of a team. We have great scientists, great nurses, great doctors in South Africa, and we all work together. I'm lucky to be the leader of the team, but I can tell you that I have very smart people, very dedicated and wonderful people that I work with, you know, and also the people that volunteer for these trials are just amazing. You know, they want to contribute to science, and they stand up and be counted, and they say, I know how HIV feels, I know how it feels in my community, and I want to make a difference. And that is, for me, is even more gratifying, to have people that are willing to walk with us in this path to find an HIV vaccine.
And what do your kids think about Mom being so famous?
Oh, they think it's pretty cool.
All right, Dr. Gray, congratulations. We're very, very proud, and we wish you the very best of luck with the work that you continue to do, because you've quite literally saved thousands and thousands of lives, and for that we thank you.
Thank you.